So, what's my background and why am I doing breast cancer? The reason is that I wanted to be a doctor, so I trained in London, and then I was interested in cells, so I did a lot of cell biology. And cancer is good for cell biology. And then I got interested in breast cancer because I trained in endocrinology as well on the way. So it's a good subject for endocrinology, and it's a good subject for cell biology, and it's a good subject to try and make advances to help women. So what have been the breakthroughs in breast cancer research over the years? A lot. Tamoxifen was introduced in Manchester, and in fact Andrew Baildon, who's one of our surgeons, and myself did what's called the first window trial, and that's giving the drug before surgery. Nowadays a lot of drugs are used in that position to test them. And then over the years, in my subject, which is the endocrine treatment of breast cancer, we did further development of tamoxifen so that we now know that it prevents breast cancer coming back. We now know that it prevents breast cancer overall. And then we developed other drugs better than tamoxifen. One of them is called an aromatase inhibitor called anastrozole. And that was better than tamoxifen in preventing breast cancer coming back, and also is better for prevention, so that's an advance. And finally, we introduced a new type of tamoxifen called a pure anti-estrogen, which is now the treatment of choice for advanced breast cancer, but the new one coming through I think will be used to prevent breast cancer in the future. The next thing is, what about prevention of breast cancer? I've sort of alluded to it a little bit, but first of all, you want to help women at high risk, and particularly with a family history, so we set up, I think, one of the first clinics in 1987 to help those women. They're referred by their GPs to our clinic, and we advise them to gene testing and things like that. Also, they are able now to have preventive drugs such as raloxifene and tamoxifen and anastrozole. So that's good for prevention. Also, Michelle Harvey in our group is particularly interested in lifestyle prevention, particularly, for example, the 2-day diet. And we published a book on that a couple of years ago, which changed the way that people dieted, I think. And that can be used to prevent breast cancer as well. What advice would I give to women who want to lose weight to reduce their risk? Well, the first advice is not to gain weight in the first place. So if you're slim at 20, try and remain slim until you're 50, 60, or 70. Second, whatever suits you in terms of losing weight, but we do know that losing 5% of your body weight reduces postmenopausal breast cancer risk by about 20 to 40%. So you might wish to use the 2-day diet. We did that because it's easier than the standard diet, and you lose twice as much fat twice as fast. Question, what needs to be done in terms of research into breast cancer overall? Well, that's big. And the charity Breast Cancer Campaign had a gap analysis where all the gaps in our knowledge were identified, and that's published in the journal Breast Cancer Research, and that is widely quoted and is very good. We did one for prevention last year. And the gaps are still huge because women with advanced breast cancer still die from advanced breast cancer, although we can keep them alive much longer. We can prevent cancers coming back after surgery, but not all of them. So until you can do that, you've failed. And we can only prevent half of breast cancer, so that we need to try and see how we can prevent more. So what about the Manchester Breast Centre in all of this? Well, we're beautifully placed to answer some of those questions, and we have done over the years. The Manchester Breast Centre started in 2005, but most people were here at that time. It was just better to get people under one name and talking from the same hymn sheet. And so we have a dual program in the Manchester Breast Centre. There's the laboratory work, several laboratories here at the Patterson Institute and at the university, and also clinics at the Christie Hospital, clinics at the Genesis Prevention Centre, clinics at the Breast Centre in South Manchester. So that's the sort of axis we have in the Manchester Breast Centre, from the clinic through to the laboratory. It's very exciting.